The reason that we're showing you this is you've just had a visual field taken, and this is your visual field here. And the reason that we had you take the visual field is you've either been in an automobile accident, you've been hit in the head, you've either had head trauma, or you've had a whiplash. A whiplash, head trauma, that type of thing causes damage to the vision system. Today what we're looking at is the damage it causes to your visual field. As you can see from this picture here, you can look at the blind spots over here. They are enlarged over here. This shows reasonable peripheral vision except over here where it's indented. Depending on each person that sees this, yours could be a varying amount from very small ones to very large visual fields. But all of them are hurt. Well, why in the world does this happen? Well, the eye, we'll draw a picture of the eye. And there's the Jolly Green Giant's eye, and there's the nerve coming to the eye. Well, it's got to go through a bone in your head, right through here, in the back of the eye. There's a bony place that holds it. And if you can see how small that particular nerve is in relationship to the eye, if there were not 6 very strong muscles holding that eye in place, the eye would just pop right out. But luckily these muscles hold it in. But it pulls on this, on the nerve, and then we think it breaks little teeny blood vessels right inside here. And then when those blood vessels break, it causes swelling inside the eye. And it's kind of like, then what happens, it's almost like stepping on a hose, the nerve gets crimped, all right? And so the peripheral part, the edge of the nerve hits the edge of the eye, and that's why your side vision goes down. And of course, where it enters there, right there, that's where the blind spot is, and it gets bigger. That's why this type of thing happens to your eye. Now, why in the world won't it come back? We honestly don't know why it won't come back. We've had many people, sometime up to 20 years, where they've had an automobile accident and there's still damage showing. It was only last week, one of the first patients we ever saw that did have an incident like that no nerve damage was there anymore. So that is very rare, and almost all of the time you have the nerve damage. Okay? Now, what a lot of doctors believe, and I want you to know this is a false belief, okay, that you cannot fix any damage that's done to the visual field. The reason they do that is all of the nerves in the eye, or all the nerves in your body, are very much like an electrical cord, right? There's a rubber coating on the outside, and then the copper thing on the inside, where the electricity is carried. That's how it's in there. It's called this outside edge is called a myelin sheath. If a nerve ever breaks, the only way it can heal is the outer sheath has to come back together first, then the nerve can grow. Now, the problem though is at the eye, right in there, there's no longer that sheath. They call it a myelin sheath. So any damage done inside the eye, in here, you can't grow the nerve back, and the damage is permanent. And that's why they think that. But what they've forgotten, all the way from the brain up in here, along where the optic nerve comes to the eye, that's where we're measuring. In your particular case, we know we're measuring right here, right where there's still a myelin sheath, so it can come back. Okay? So therefore, this is treated. Number one, why would you treat it? Well, it's pretty obvious. If your peripheral vision you have trouble with it, you would have trouble with driving. Okay? And you'd want to be safe when you're driving. Now, what happens is a figure-ground relationship is broken up when you have this type of a problem. So when you're driving, the figure is the car ahead, and the ground is the periphery all around you. Okay? And so can I tell where I am while I'm looking at the car? So I think you'd agree that's probably a good reason to have that. Let's say be safe driving, which is easy to understand. However, any figure-ground relationship is interfered with this type of thing going on. So in a normal conversation that you're carrying on with somebody, when you're carrying on a conversation, what they are saying, that's figure. Ground is your belief. Can you hold on to your beliefs while they're talking and expressing their beliefs, and vice versa? That would be important for a simple communication. It would be important for learning in school. So there are many reasons why you'd want the visual field to change. How can we change the vision field? Well, it's done by light. We just simply shine a light in your eyes. Now that sounds unusual. but many of you may have heard of something called seasonal affective disorder. That's during the winter time when there's a cloud cover. There's depression caused by people because the sunlight is not getting through. The treatment for it is ultraviolet light. This particular room in here where we are has ultraviolet lights on the ceiling. And matter of fact, every room in our office has ultraviolet lighting. Theoretically, we're not depressed in the winter because we have this, you'd say. But anyway, can you imagine then if simple ultraviolet light, just shining, can change an emotional defect of seasonal defective disorder? Imagine shining a very specific colored light directly into your eye, what that can do. So hopefully we've explained to you what's going on here. If you needed additional questions asked, you'll find me in the office in a personal note, and I can explain personal things for you. And this is treatable, and so we want to set up a consult where we can talk about how to treat it.